gallbladder meridian, one of the things to do is work with them in sideline, because it makes the most sense. Because if you look, it's all on the side of the body. So just turn to your head down. So now, when you're working with someone in sideline, you want to do a couple of things. Is take the time to align them properly so their body can take the pressure of the technique. So, okay. And like in standard types of body work where you stay like this. When you look at alignment when somebody is standing, and you look at them from the side, you look at these landmarks, how the ear lines up with the shoulder, and the shoulder with the hip, and the hip with the knee, and the knee over the ankle. That's what they call plumb line structure. So that gives you some sense of what parts of your body are forward or back of your center line. Because again, we're working in gravity, it's good to try to keep an aligned verticality, right? Because anything deviated either front or back from that plumb line puts more stress on the system, right? So we want to try to keep that alignment. So when you're working on someone, even in sideline position, you should take the time to line them up so that they have general alignment between their ear and their shoulder and their hip and their knee and their ankle, right? So that means that they're in a good line and they can take pressure easier, okay? So the gallbladder meridian, we're going to start with just some simple compression. And remember, the gallbladder meridian starts here and then it zigzags, right? And then it comes to the side of the neck into the top of the shoulder, and then it comes in front of the shoulder, and then it comes right down the side of the torso, and then it goes right through the hip, down the IT band, and then below the knee in the lateral lower compartment of the leg, it goes to the peroneals. It goes in front of the ankle, into the dorsal surface of the foot, and out the fourth toe. So we want to position in a sense where we can do a little compression of the line. So that's why we're going to start here, and we're going to mash down on their head.
Nice.
So the heel of the hand, not over the ear, but here in the temporal area. Just want to mash down on their head. Right? And again, it's through your extended arm. You're not pushing, you're just leaning in. Right? And then you're going to come down. So the transition is this. I'm up on one arm, one knee and one foot. And then I'm going to come like this. And then I'm going to take my arm here like this, so I have good control. So the meridian comes right through here, and there's a major release point for the gallbladder right on top of the shoulder, and it's gallbladder 21. But if you feel on yourself, halfway between the base of the neck and the acromion, right on the highest portion of trapezius, there's like a little lump there. It feels like another head is starting to grow out of your shoulder. On me it does anyway. So this is gallbladder 21, and this is a very good release point for the tension that's above it. Also, it's contraindicated when in pregnancy, because it sends energy so strongly down into the body. That's why it works good as a release point for here, because it takes this energy and just sends it down. But it could also disrupt gestation period to a certain extent. And I think that's pretty close to termination, you know, like when they're getting close to deliver. But nonetheless, we just sort of avoid it all the time. But listen, if you're not carrying a child, it's an awesome point to work on. So, and the point is right here. So we're going to start to open it by first leaning back with our body weight to stretch here. You notice how his head is coming. So that means his neck is tight, right? So this stretch is good because I'm stretching this side and the weight of his head is pulling on the other side. So it helps open up that shoulder a little bit. And then we're going to take our fingers and just curl it right into that point, and we're just going to do some deeper circular. It's okay, man?
It's good. I mean, it hurts, but it's good.
He's got your back.
Okay, so we're doing circular friction. And because the meridian comes in front of the shoulder, we're going to let our hands separate, and we're placing them on the front and the back of the shoulder girdle, and we're going to do some nice range of motion just to open that up. And then we're going to stretch the arm to help open up the side torso. So we're here, so we're just going to come up like this and stretch, opening up the ribs. So this is called collapse position. Here, here, and I collapse my body onto the arm and then just lean back. Good stretch. Collapse position. And then you come out of that and we're just going to do some compression right into the side of the ribs. Put the arm down. And then we're going to come right up to the hip and position ourselves so we can compress. Is it okay?
Yeah, I'm fine.
It's just for the video. We're going to position ourselves so that we can compress in the hip, IT band, and the lower portion here. So where would that be? One thing is this. You can come like this. And I put my foot here so if I'm pressing the hip, the leg doesn't come out. So I lock it in like this just by placing it, but I'm right over the hip. And if you feel for the ASIS and the greater trochanter of the femur, in between the soft area is where you want to press, all the soft tissue of the hip. And one thing is you can just use the heel of your hand to sink right in. And it's very effective because you're right over and your arms are extended and you can just let your weight sink in. So again, relatively easy, but you can sustain some compression this way just by leaning in. So you do a couple times, yes? And again, in between the bony landmarks, not onto the bone. And if your body can accommodate, you can come in, lean your elbow in there too. And when I say accommodate me, if it's comfortable for you to lean in this way. If not, just continue this way, it's okay.
I notice you've got your knee on the other leg.
Yeah.
Also for bracing.
Bracing, and also brings me over. I can lean in a little bit more. Okay. And then you're going to continue down the IT band, so you just do some palmar compression. And you want to start IT band compression just immediately distal of the greater trochanter of the femur. So you feel for the greater trochanter of the femur, and then you come below that, and then that's where the IT band is. So you can just compress in, and then continue here. But rather than this, since my foot is right there, I just do this. Okay, ma'am? Right? Arch of the foot right in the peroneals, because this is where the meridian goes. And I'm just shifting my weight over. And again, it's the arch of your foot, easy. Then you want to stretch here a little bit, because this is where the source point is. So as you're compressing, then you come down onto the dorsal surface of the foot and push down, because that opens this area up here. And then you want to come and feel where the source point is. And the gallbladder source point is in front of the lateral malleolus and